PCOS is a condition that affects the hormone levels of women. PCOS-afflicted women produce abnormally high levels of male hormones. This hormone imbalance causes their body to forego menstruation and makes pregnancy more difficult. PCOS can also make hair grow on the face and body, and it can make a person go bald. And it can make health problems like diabetes and heart disease worse in the long run. Birth control pills and diabetes drugs that treat insulin resistance, a sign of PCOS, can help fix the hormone imbalance and make symptoms better, but it might do to a woman's body. What exactly is PCOS? PCOS is a hormonal disorder affecting women during their childbearing years, ages 15 to 44. PCOS affects between 2.2 and 26.7% of women in this age range. Many women have PCOS without being aware of it. According to one study, up to 70% of women with PCOS were undiagnosed. PCOS affects a woman's ovaries, the reproductive organs that generate hormones that regulate the menstrual cycle, estrogen and progesterone. The ovaries also produce a limited amount of androgens, which are male hormones. The ovaries discharge eggs that are fertilized by the sperm of a male. The monthly discharge of an egg is known as ovulation. Produced by the pituitary gland, follicle-stimulating hormone, FSH, and luteinizing hormone, LH, regulate ovulation. FSH causes the ovary to produce a follicle, which is a sac containing an egg, and LH causes the ovary to discharge a mature egg. PCOS is a syndrome or combination of symptoms that affects ovulation and the ovaries. Its three primary attributes are: cysts found on the ovaries. High levels of male hormones are linked to irregular or absent periods. In PCOS, numerous fluid-filled sacs develop within the ovaries. Polycystic means containing many lesions. Each of these sacs is a follicle, which contains an immature egg. The oocytes never reach maturity to initiate ovulation. The absence of ovulation alters estrogen, progesterone, FSH, and LH levels. Progesterone levels are below average, whereas androgen levels are above average. Extra male hormones disrupt the menstrual cycle, resulting in fewer periods for women with PCOS. PCOS is not a novel disorder. Up to 70% of women with PCOS have insulin resistance, which means that their cells can't use insulin properly. Insulin is a hormone made by the pancreas that helps the body get energy from sugar in food. When cells can't use insulin the way they should, the body needs more insulin. To make up for it, resistance is often caused by being too fat. Both being overweight and being resistant to insulin can make you more likely to get type 2 diabetes. Inflammation. Women with PCOS often have more inflammation in their bodies than other women. Inflammation can also be caused by being overweight. Researchers have found a link between too much inflammation and higher androgen levels. Common PCOS symptoms. Some women begin experiencing symptoms during their first period. Others discover they have PCOS only after gaining a significant amount of weight or having difficulty becoming pregnant. Irregular periods. A lack of ovulation precludes the monthly shedding of the uterine lining. Some women with PCOS have fewer than 8 or no periods per year. Severe blood loss. The uterine lining builds up over a prolonged period of time, resulting in heavier than usual periods. Hair proliferation. More than 70% of women with this condition develop facial and body hair, including on the back, stomach, and chest, and is known as hirsutism. Acne. Male hormones can result in oilier than usual skin and acne on the face, chest, and upper back. Excessive weight increase. 80% or more of women with PCOS are overweight or obese. 11. Male pattern alopecia. The hair on the cranium may thin and fall out. The process of the epidermis becoming darker. In folds of the body, such as the neck, groin, and under the breasts, dark regions of skin can develop. Headaches. Hormonal fluctuations can cause migraines in some women. If your levels of androgen are higher than normal, it can affect your fertility and other parts of your health. Infertility. You have to ovulate in order to get pregnant. When a woman doesn't ovulate regularly, she doesn't put out as many eggs that can be fertilized. PCOS is one of the main reasons why women can't have children. Endometrial cancer. During ovulation, the lining of the uterus falls off. If you don't have your period every month, the lining can get thicker. Endometrial cancer risk goes up if the lining of the uterus gets thicker. Depression. Changes in your hormones and symptoms like hair growth that you don't want can both make you feel bad. Many women with PCOS eventually feel sad and worry. PCOS is identified. Typically, doctors diagnose PCOS in women with at least 2 of these 3 symptoms. Elevated androgen levels. Irregular menstrual cycles. Cysts found on the ovaries. In addition, your doctor should inquire whether you have experienced symptoms such as acne, facial and body hair growth, and weight gain. A pelvic examination can detect problems with your ovaries and other reproductive organs. During this examination, your doctor inserts gloved fingertips into your vagina and examines it for any ovarian or uterine growths. Male hormone levels in excess of the norm are measured by blood tests. You may also undergo blood tests to measure your cholesterol, insulin, and triglyceride levels in order to assess your risk for cardiovascular disease and diabetes. An ultrasound uses sound vibrations to detect abnormal follicles and other ovarian and uterine issues.